am Sarah Winke, and I was in a group with Erica, Nicole, and Adri Franson, and we decided to do Herpes Zoster, which is better known as shingles. So what is shingles? It's a viral infection that causes a rash on your body, and it can occur anywhere, but it typically occurs in a stripe of blisters or lesions, usually around the side of the torso, and it's very localized. It comes from the virus varicella ZS, and you can get chickenpox when you're younger, and then the virus lives dormant in you until it appears again as shingles. So some symptoms and assessments. So you've got, causes, sorry. It's caused by the varicella zoster virus, and it's from the chickenpox virus. And again, it lives dormant in you, in your nerve ganglion, and then it appears later in life. And then as it reactivates, it travels along nerve pathways in the skin, and it causes the symptoms of shingles, which is why, and the reason why shingles occur is kind of still a mystery, but it may be due to a lowered immunity to fight infections as you get older. And then genetic susceptibility has also been classified as one of the most important risk factors of shingles, and it can be passed down. And shingles occurs in both genders, but 80% of all cases occur in people older than 20. Some symptoms and assessments. Usually you'll have skin hypersensitivity in the area where the shingles will occur. You'll have a mild rash of red spots that turn into blisters and can be very painful. And then those blisters, they turn yellow and dry, which are very sensitive to touch. And then the rash goes away in about 1 to 2 weeks if treated properly, and it's usually localized again to one side of the body. So to assess the patient, you're going to want to gain a history of pain before the rash develops, so that way you can determine whether or not shingles. And then you also want to do a physical examination. They can have fever, anorexia, and fatigue. Those can all be signs of shingles as well. And the psychological assessment is also really important. My grandmother had shingles, and I remember how afraid she was to even go to church because she didn't know if she'd be screaming in pain in the middle of the sermon. So it's a very painful and mentally challenging disease as well. So to diagnose this disease, you're first going to look at the history of the pain on the side of the body where they have those lesions. And they're also going to check if they have chickenpox. They should report a history of chickenpox. Some people experience shingles without a rash, but that's really uncommon. And so then in that case, you'd need to use a lab test to diagnose. And the best samples for viral culture are swabs of unroofed vascular lesions and scabs and crushed lesions during the first couple days of those ulcerations. So basically just getting a sample directly from the lesion itself. And then finally, a PCR test is used to detect if the virus DNA is quickly dividing and if the area is sensitive. So for treatments, you have a couple options here. So antiviral medication, and that decreases the duration of the lesions and as well as the pain that the patient experiences. Corticosteroids are taken orally, and they can help with possible nerve damage that can occur with the level of pain and infection. And then Calodrol lotion contains calamine, and that is super soothing to the skin and can help with the pain and discomfort. And then finally, the varicella zoster vaccine is recommended in some cases because it can help reduce the risk of developing herpes zoster again, even though many patients do not have it again. So the prognosis and follow-up. So most affected will have one attack, but 10% will have another one later in life. And you can't really eliminate the virus from the nerve ganglia. That's kind of just itself if it's gonna flare up again. And some doctors will encourage vaccinations to prevent a future reoccurrence. And the patient should definitely understand all the medications that they should be taking and the way that they should be taking care of their body, because it is very painful and they want to prevent it as best as possible. And if the symptoms do come back, a follow-up appointment could be necessary to reassess. And these are sources.
I have a quick question.